All right, Jeremy, it's 9:30. Other people may log in or may just watch this again later on this afternoon or tomorrow. So thank you for being here today, Jeremy. For those of you who don't know, Jeremy Clark is the CEO of the Hilton Head Regional Healthcare. And as many of you might know, I have served on the board of directors there for the last 6 years. This is my final year in my term. And Jeremy actually started the same time that I started on the board. So we've been together right from the very beginning. So I appreciate everything that Jeremy has done, and I have learned so much from being on this board. It's been a great experience, and a great experience representing our realtors on this board and how our realtors interact with our community and the importance of our realtor community in regards to sharing information about healthcare. You know, our realtors get asked lots of questions, from anything about, what's the best restaurant, to how are the schools, and certainly how is the healthcare. And probably more now than ever, people are going to start questioning about our healthcare and what services we have here in our region to help. So, lots of times I find when people think, you say Hilton Head, they think Hilton Head Hospital, but it's really much more than that. They're actually their sister hospital out in coastal Carolina, out in Jasper County. And really, they service throughout the whole county in Beaufort and Jasper County. So Jeremy, I think the hot question is COVID-19, but we want our realtors here today to learn more than just about COVID-19. We want them to be able to, learn about Hilton Head Regional Healthcare and the services that you offer, so that when they have clients and customers that come and they have a way that they can give them some resources and have a conversation about the quality healthcare that you offer here in the region. So I'm going to let Jeremy take it from here.
All right. Well, thank you, Jean. Again, I really appreciate y'all having me today. I'm going to try to share my screen here with you, and so we'll see how that goes. And while I work on this, I will say Jean has been a great board member for our hospital and has done a great job representing you guys and bringing your perspective to us as a hospital leadership team, and then also to a board, as a board. So Jean, it's been great working with you over the past few years, and look forward to continuing to work with you into the future, just in different capacity. But we appreciate everything you've done.
Thank you.
So yeah, as Jean said today, I really appreciate being here. I'm going to talk a lot about our healthcare system and some of the services that we offer. Some you may be aware of, some you're not aware of. But I am going to start off talking about COVID-19, and I'm not sure. Hopefully, you can see my slides there. I'm going to talk a little bit about this, and then we'll get on to everything else. But truly unprecedented times. I think back to early in this, someone was talking to me, and they asked me, have you ever been a part of something like this before? And I said, no, this is my first global pandemic. So it was, it's a first for all of us trying to navigate through this. And, you'll hear COVID-19 called a lot of things. You'll hear COVID-19, coronavirus. But I always like it when it's referred to as the novel/new coronavirus. And because I think that word novel or new really says it all about this. This is not something that we faced before. And as a result of that, you're going to consistently hear new information, conflicting information, guidance that may or may not be accurate, guidance that may be accurate one day and is not the next. There's just so much that we don't know about this virus yet. We're learning. I feel like we're learning more every month, but there's still so much that we don't know. And it leads to a lot of misinformation that's out there. And it's I don't think any of it's malicious. But you have two sets of people. You have people who are hungry for information, and then you have people who want to share information, whether or not it's 100% accurate or not. But there's a lot of information out there. We're a very information-focused society right now, but especially with something like this. I was talking the other day, when most drugs are going through for a therapy, they go through 3 phases of trials: phase 1, phase 2, phase 3 trials. And in normal times, you don't hear anything about them during those trials. And it's because oftentimes, drugs will make it through 1, but not 2, 1, 2, but not 3. And so they never make it, you never hear about them. Given our thirst for knowledge and information on this, the minute any kind of study comes out or any kind of success in early clinical trials comes out on a vaccine or on a treatment for this virus, you immediately hear about it. And while that's good and that we're learning about it, it also means we're going to be disappointed, or we may, things are not coming out fully cooked. And so you'll hear about studies that come out that have not been peer reviewed, which again, in normal times, you don't hear about these until they're well thought out and well through the process. So I'd warn everyone, there's a lot of information out there. I continue to look at the CDC website, DHEC website is really the bearers of truth in this, just because there is so much new information out there. Over the last 3 months, we did a lot of preparation in our hospitals. We, like you guys, we watched the news reports from New York. We saw those images and we thought, oh my goodness, that's going to be us. So we took down our census purposely, the number of patients that are in our hospitals. We canceled elective procedures unless they really needed to be done, and really kind of got ready. But one thing that we learned, while this virus is global, the impact varies locally. And so what you saw happening in New York, fortunately, never happened in this community, or it hasn't happened yet in this community. And so, as we kind of realized that, hey, it's not as bad here, it's not, coming for us, right now, we were able to ramp back up our services. We really focused hard on creating a safe environment within our organization. We had an adequate and now a more than adequate supply of personal protective equipment that our staff and physicians use. I can still say to this day, 3 months later, we've not had one case of transmission of the virus from a patient to a staff member. We've not had to quarantine any of our staff, which is great. So when doing all this, we were able to resume elective care in April, and in May, we started allowing one visitor back in the hospital, one visitor per day. And we had really cut out all of these things just in an effort to try to understand the situation and to keep our patients safe. Throughout all of this, and this probably won't surprise y'all at all, but the community support, the support from our community has been absolutely incredible. So we've seen, people making masks and bringing donations, and especially bringing a lot of food to our staff, which is always the number one thing that gets grabbed up. So it's been great to see, and I will say it's been really special to see it as well when a lot of the restaurants who are donating food were having really tough times themselves in March and April. So that was, it's one of the many things that just makes our community so special. So as we flash forward to today, I'll tell you what I'm looking at and what we're doing every day. Right now, we are not seeing a spike in hospitalizations. So I think this morning we have 2 patients of our 70-something that are hospitalized with COVID-19 at Hilton Head Hospital. There's less than that at Coastal right now. So we're not seeing a spike in hospitalizations. However, we are seeing more positive cases in the community. You've probably read some about it. You've heard about it. That's data that we're seeing as well. The good news is right now, at least, those patients are either have mild symptoms or are asymptomatic and are not sick enough to warrant a hospitalization right now. So that's a really good thing. But we are closely monitoring that, and we know that if we need to, we can take down our census again. We can divert resources to COVID patients. We can add beds. We can do all of these things. So we're definitely keeping a very, very close eye on it. Part of the way that we are getting our data and that we're going to make sure that we're keeping everybody safe is through more testing. So already today at both Hilton Head Hospital and Coastal Carolina Hospital, we are offering outpatient COVID testing to anyone with a physician order. We're doing that 5 days a week for about 4 hours a day. And after a slow start a couple of weeks ago, we as a market, as 2 hospitals, we're now testing up to 100 patients a day. So there is a lot more interest in this, as you can imagine, with the cases kind of spiking in it. But we're also working to bring more tests to the community. So there's a little bit of media coverage out there this week. I think there are some rumors out there in testing, but what I can tell you guys is that we have worked directly with South Carolina DHEC, Volunteers in Medicine, and Hilton Head Fire and Rescue, and we're planning a large community testing event on Monday, June the 29th. So that is set. I was over they were having it at the Hilton Head Fire Rescue Training Center, which is a great spot where you can get lots of traffic in and can handle it safely. Was over there this morning with the fire department and the sheriff's office, kind of scoping that out. But we're going to do more of these. We had one in Hardyville this this past Friday and Saturday. We've got another one coming in Jasper County. We're going to be really targeting Hilton Head, Bluffton, Sun City areas as well as we go throughout the summer. Because testing is the headline. That's what everyone likes to talk about. We need more testing, and that's true. But we're looking at it as a test and educate. We know that about 90% of the people that we test are going to be negative, which is great. Our goal is to hopefully educate them on how to stay negative. And the three biggest things that we always tell people are wash your hands, wear a mask, and keep your distance. Those are the three things that were really very simple things that we were trying to remind everyone to do to help prevent the spread of it. We can't, we're not going to eliminate this virus overnight, and it's certainly in our community right now, but we can limit the spread of it, and that's really what we're focused on. So there's a lot going on with COVID right now. There will be new information next week, I'm sure, and it's something we're watching and monitoring and adapting to in an effort to keep our community safe, keep our patients safe, keep our colleagues and our staff and our physicians safe as well. So a lot going on. Jean, do you want me to take questions at the end throughout this? How would you like for me to handle this?
I have one question here. Sure. So let me just kind of throw this out at you before you go on to the next topic. So the question is the over at the fire station, or when you're going to do it over at the fire station, do you have to have a medical order?
Great question. The answer is no. So the big community events that we are hosting are going to require no physician order required, no appointment necessary, no cost to the patient, are really the things that we're trying to focus on, so that hopefully we can get as many people out there to be tested as possible. Right now at the hospitals, we are requiring a physician order because we really wanted to focus our testing on at least patients who are symptomatic. However, even that will be changing in the near future, where we're going to open that up to patients without a physician order, because we really want to encourage people to come and get tested if they're concerned.
Yeah. Okay. And what's the date again? June what? Monday?
Monday, June 29th.
29th. Okay. Great. Okay. That's good about COVID. Tell us more about the hospital.
So let's go in, and you guys know this. You guys see this firsthand. When we look at Hilton Head, Bluffton, Oakity, kind of out that way, I tell everybody all the time, we're not your typical small 100,000 person town, right? There is nothing typical about our community, and I mean that in a great way. We have award-winning communities and developments within our larger community, award-winning restaurants, RBC Heritage kicking off this week. So very excited to have those guys here, if not a little bit different. But the amenities and the organizations that we have in this community are not typical for a community this size. We are very fortunate to have that, and it's basically, we're able to have all these things, I think, because of the people that we have here that allow us to do some really incredible things for the size of our community. So likewise, Hilton Head Regional Healthcare is not your typical small health system. So, Hilton Head Regional Healthcare started with Hilton Head Hospital, established in 1975, and it was really that development that allowed people who lived in this community, or people who are moving this community, to have access to high quality inpatient care here without having to go out of the community to receive care. So over the last 45 years, it's been really exciting to grow our health system as our community has grown. So in the late 90s, we established the Bluffton Oakity Outpatient Center out right next to Sun City, which at the time was way out there. Now it's right next door. And then over time, in the mid 2000s, the acquisition of Coastal Carolina Hospital for them to join our system. We opened up our Bluffton Medical Campus, which is an outpatient facility in Bluffton, in early 2014. It's really become a hub for healthcare in the community. And then most recently, less than a year ago, we opened up the new Tidewatch freestanding emergency department in Bluffton. First of all, a freestanding emergency department is kind of what it sounds like. It's an emergency department that is not attached to a hospital. So all the things you think about for an emergency department, it's open 24/7. It's staffed with board certified physicians. It's staffed 24/7. We have access in it to imaging, to labs, takes ambulance traffic. It's really everything you need in the ER. It's just not attached to a hospital. And its location, it's located just north of the 278-170 intersection, just north of that on Tidewatch Drive on the left-hand side as you enter into Sun City. So it's been incredibly successful. The community has really embraced it. We're seeing volumes there, visits there much higher than we originally expected. which is great to see. You know, I wish I could say we planned it this way, but what we're seeing with COVID is a lot of people who really don't want to go to a hospital, despite the fact that we've created a very safe environment here, are choosing to go to Tidewatch instead. And we've actually seen an uptick in volume there. So it's great to have that option for folks in the community. You know, as we look at our different service lines, you know, again, not the typical small health system for cardiovascular care, for hearts. You know, Hilton Head Hospital is a 109-bed hospital. Most 109-bed hospitals do not offer open heart surgery. That is not normal anywhere across the country. But, you know, this is one piece of our comprehensive cardiovascular services, which goes with elective and interventional cardiology, which is, you know, opening up arteries, saving lives. Folks who are having a heart attack, we really practice and rehearse our door to balloon times, the amount of time it takes from the time a patient gets to our door until they have the life-saving procedure. We're really continually working to get that down, and it's averaging less than an hour right now, which is really best practice. We're aided a lot by the fact that we have an outstanding EMS support system in our community. Hilton Head Fire and Rescue, Beaufort County EMS, both outstanding organizations that do a great job and are great partners of ours in getting patients here when they call. One thing that you guys may hear about a lot in the community right now related to COVID is patients are scared to go to a hospital. We are seeing anecdotally over the last 3 months working with our EMS partners, we're hearing more and more stories where patients are literally dying. People are literally dying at home because they're scared of going to the hospital and getting COVID-19, which is really, really concerning. So we've done a lot of things in our ER to create that safe environment so that they're getting dedicated rooms, private rooms inside our hospitals. But there's still this fear out there. So as much as you can, tell people if they are having any kind of medical condition, call 911. We have outstanding EMS partners. They are trained in how to prevent the spread of COVID-19 and are doing a great job with it. But a lot going on in cardiovascular disease. We've invested in some great technology, the Micra, which is the world's smallest pacemaker. If you know someone with a pacemaker, you're used to seeing them with something on kind of the size on that left-hand side. Now the Micra is about the size of a vitamin. It's implanted in there. It's getting really less complications and better outcomes for our patients. We also have invested in some really life-saving technology called the Impella, which is a heart pump. It's for people whose hearts are just too weak to pump the blood as it needs to be done. We can insert this in, pump the blood for them until they get healthy enough for either an operation or discharge or transfer to someone else. So we're seeing more and more patients whose lives are being saved because of this technology. And you see kind of in the center of the picture, Mr. Casper, who is a resident here and who had a heart attack on the Salty Dog boat one evening, and came here and spent some time with us. And Dr. John Kellerman is our cardiac surgeon who saved his life. So really great stuff going on, not typical for a health system this size. So I'm really proud of our cardiovascular program. You know, I touched a little bit about emergency care. Again, both hospitals have great ERs. What some people may be surprised to know is that over the last couple of years, the number of visits at the ER at Coastal Carolina Hospital has actually overtaken the number of visits at Hilton Head Hospital. You guys see the growth, know the growth that's going on out there. So it's great to see patients trusting Coastal Carolina and Hilton Head Hospital as well. And then I referenced the new Tidewatch Emergency Department. Again, 24/7 access to emergency care. You know, people in the community ask, well, if I'm having a heart attack, which hospital should I go to? If I'm having a stroke, which hospital should I go to? What I would always say, and I would say this in our community, I'd say this in every community, is get to an emergency department the fastest way you can. Most of the time, that's gonna be calling 911, going to the closest one, but we can start care there. And if you need to be transferred, that's fine, but at least we can get care started and initiated and start any kind of life-saving work that needs to be done for you. So don't spend time worrying about which ER to go to, just get to an ER. And we're fortunate that we are now spreading, adding new ERs across the community. You know, for a long time, Hilton Head Hospital has been known for having a strong orthopedics program, and we're fortunate to have some great orthopedic surgeons on our staff. You know, what I like about many of the members of our medical staff is that they reflect this community, and they're all really well trained and either really well trained in different universities or academic settings. or have practiced in really large, really well-known health systems. And I always have to look at Dr. Chad Zims, who's the newest orthopedic surgeon in our group on the right-hand side. Dr. Zims is very well trained. He went to one of the most premier orthopedic fellowships in sports medicine in Vail. But I thought it was a lot cooler. He was actually a surgeon with the Packers. So that's we're going to highlight him, and he's brought a great new perspective on things to our organization over the last year. Working with those guys, working with the staff in the OR and the staff on the floor, we've really worked hard at preventing any kind of infections in knee replacement surgeries or the orthopedic surgeries. So really continuing to work on that, and orthopedics remains one of our strongest service lines. We do a lot of knee replacements, a lot of hip replacements, with some really outstanding surgeons leading that charge. A lot going on in babies, especially in the Bluffton area, as we continue to grow out there, as younger families are moving to this community, and as more and more people want to move to our community to start families. We are seeing a growth in obstetrics volume. We're very fortunate to have the physicians of Riverside Women's Care. This is a 6-physician group that is based in Bluffton and Beaufort. And for the last 5 years, 6 years or so, they've been providing what's called a laborist model of care at Coastal Carolina Hospital, which means that a physician is on site, an OBGYN, board certified OBGYN, is on site 24 hours a day, 7 days a week. No matter when mom shows up for delivery, we've got an OB there waiting on them. And, we did that because we know that babies don't always come on time. Sometimes they come early, and we want to make sure there's an OB there to take care of them. Sometimes they take their time, and we want to make sure our patients don't feel like they are rushed by an OB who's trying to get home for the night or trying to get to clinic or whatever the case. So really, this laborist model has been shown nationally to result in much better quality of care. And we've seen great outcomes and great satisfaction from our patients with this model. What's really exciting to me is that starting this summer and then into the fall, Riverside is expanding onto Hilton Head Island. So the physicians who are currently the OBGYNs who are currently in Riverside Women's Care will have an office in the medical pavilion right next to Hilton Head Hospital. And then starting in September, we will roll out the laborist model of care to Hilton Head Hospital as well, where we will have one OBGYN on site 24 hours a day, 7 days a week. Again, it's been shown to provide great quick care nationally, and we know firsthand it provides great service to our patients. So very excited to have this. The physicians are really top notch, and we're already, we've got 3 others signed who will be joining them over the next couple of months to join that great group, which we're really excited about. Finally, another big service that we're known for is spine surgery. And we're very fortunate to have 2 outstanding spine surgeons on our medical staff, Dr. Jeff Rubin and Dr. Craig Boatwright. I've got their CVs up there. And, when I think about high caliber, highly collegial individuals, I mean, these 2 guys just stand out. Outstanding, very well trained. I mean, Dr. Boatwright was a Rhodes Scholar himself. I think they are so reflective of our community, our community has so many, well-trained folks who could be doing anything, who could be doing what they want to do anywhere in the world, and they've chosen to come here. And the same is true of Dr. Rubin and Boatwright. We've invested in really precise GPS navigated technology to help them do what they do. But really, it starts with those 2 guys who do just awesome work for their patients and have helped us just develop a great reputation in spine care. So we talk about all the physicians that we have, but we're also investing heavily in our hospitals. We talked about TideWatch. I mean, that's a $15 million project, but it also brought 20 to 30 jobs along with it. We just built out at Hilton Head Hospital just about a year ago. We opened the area's only inpatient behavioral health unit dedicated to the older patient population, the geriatric patient population. So it's been exciting to see that starting to grow, and lots of technology throughout our community. We want to keep investing in this community. We know, like you guys do, how special a place it is. We see the growth as well. So it's great to be able to bring the latest technology to this community. So, I always say we're not typical health systems in terms of physicians either. The people that we have, the medical staff that we have here, I always say it's the best combination of caliber and collegiality I've ever been around with. And I've been fortunate to work in a lot of great health systems. Like our community, they reflect a diversity of training at some of the best institutions in the country, and have worked in some of the major health systems in the country as well. And like our community, like I said a minute ago, could really be practicing anywhere they wanted to, but have chosen to practice here. So we're very fortunate to have them, and I think they are, again, they're part of what makes this community such a special place. We also have great partnerships throughout our community. You see some of the groups there that we partner with. I mentioned Hilton Head Island Fire and Rescue a couple minutes ago. They are, for those who don't know, I mean, they are an award-winning EMS group, nationally award recognized EMS group for the training they have, for the protocols they have in place. Again, just incredible group there. We're honored to partner with them. And then, Volunteers in Medicine, both on the island and in Bluffton, do great work as well. And we're really heavily partnered with them right now, trying to get education and testing out to some of the communities they touch on a regular basis as well. So our system, 1,200 local employees, and at an annual wage, and a median annual wage of $60,000. These are great jobs. These are great jobs, which allows us as a community to continue to invest and hopefully bring more people to our community and allow us to continue to grow. So, I say all that to say, we're not typical. This is not typical for a 100-bed hospital to have a cardiac surgery program. It's not typical for Coastal Carolina, a 41-bed hospital, to have 24/7 in-house OBGYNs. So we're not a typical small health system, but we are such a perfect fit for our community, because our community is not your typical small community either. The caliber of people that we have, the caliber of the organizations that we have in our community are incredible. And I think when you guys are talking about our community, and you talk about the award-winning restaurants and resorts and golf courses, and the fact that Hilton Head Island has a symphony orchestra, hopefully you can also point to our local health system here as something that really is not normal for our community our size. And we're very fortunate to have it here, and very fortunate to have the physicians that we have here. So in closing, I will just ask you guys, as you are in the community all the time, I know you support many of our local organizations, which have helped make our community so special. I would ask you to support our local physicians as well. They are businesses. They need your support. We want to continue to support them so that folks can access care here in the community and don't have to travel either out of state or out of the community, or multiple hours when they need care. For the vast majority of care, we are able to provide it here, and we're able to provide it at a very high level of quality. So with that, Jean, I'll turn it back over to you and see if there are any questions for the group on anything I presented here, or more COVID questions as well.
Okay, well, great. Thanks, Jeremy. That was a great overview. Just one other comment or thought to bring in here. So the website, the Hilton Head Regional Health website, that's where our realtors can refer people to search for doctors. Is that the best resource?
That is accurate. Yes, there's a Find a Physician or Physician Finder application on the website. You can sort by your location, the specialty, all things like that.
Okay. And if realtors have people that are interested, they're the first point of contact for a lot of people. And, if they're talking to a physician, or they're talking to a nurse or someone in the healthcare practice, they can, if people are interested in employment of some kind, what's the best way to go about that?
They can always, depending on the position, they can always call our HR department at the hospital, and it's one HR department across the market for both hospitals, so they can guide them in the best direction. All of our positions are posted online as well, if they know exactly what they're looking for. We also get a lot of requests from people who are not looking for jobs, but we request for tours of the hospital. We can help arrange that as well. If they'll just call the hospital and ask, we've got a great team here that can help provide that, and hopefully we'll be able to help answer any questions that your clients have.
Okay, great. We had toured, our Jasper area group had toured Coastal Carolina a while back and saw the Da Vinci robot and stuff. It's fairly cool. I do have another question in the chat. Do you see being able to put in heart stents in the future? I believe you already do heart stents. Is that correct?
We do that today. We do that today just about every single day. We've got patients in our cath lab, and we've got outstanding interventional cardiologists. And recently, and some of you guys may have seen this recently, 4 cardiologists who've been in the community a long time, but have been affiliated with a system in Savannah, joined Hilton Head Heart, which is a cardiology practice associated with the hospital. The timing probably couldn't have been worse, given that there was COVID and there was a lot of other things going on. So it was a little bit of a rocky transition, but they're really getting some things worked out in the office now. So that's going to be a real benefit to not only our cardiovascular program, but our health system and our community as a whole, getting us all aligned and working well together.
Okay, great. And then another question here is, can you comment a little bit on the cancer treatment? I know we've talked about that as well. So where is the cancer treatment for people in this healthcare system?
So there's a couple different things. So I would not call our system a comprehensive cancer center. There are certain organizations that really invest in the full gamut of cancer care, and I think most likely because it's really tough to get those specialists. A lot of those specialists, we've chosen not to pursue that path. However, we have an outstanding breast health center that we have in partnership with the Medical University of South Carolina. It's located in Bluffton. Dr. Shelley Ringer is board certified, but really the only fellowship trained breast surgeon in the community who operates at Hilton Head Hospital, and she operates at Hilton Head Hospital every week. So for breast cancer, I feel very, very strong about our options there. And then on prostate cancer, we have an outstanding group of urologists, Dr. Langley, Dr. Eric Gwynn, who are not only trained in dealing with prostate cancer, but we also have technology that allows really kind of minimally invasive prostate biopsies, which are significantly less painful for the patient and more accurate in helping us identify exactly where the cancer is. So we're not a full service comprehensive cancer center, but I feel like we have really great options in breast health and in prostate cancer.
Mm-hmm, mm-hmm. But if people are, so if someone needs the cancer treatment to go and get the, chemo for a day, you have those services. Is that correct?
We do have some outpatient infusion. Most of the time they'll be working with a local oncologist. There are a fair number of local oncologists here, some of whom have their own chemo centers or can recommend where they want their patients to go. But we do have some outpatient.
Okay. So going back to COVID for a second. So there's a lot of chatter on social media about masks. Do they work, and what works best? So do you have to have those N95s that you all, at that level, or, the ones that we're wearing? I have put one on the other day and I felt I might as well not even have it. It was like paper thin.
So it's a great question. So the first thing, no, you do not need an N95. N95s are kind of the highest grade, but really they're not even recommended unless you're in a healthcare setting doing an aerosolized procedure where the virus may be aerosolized and could be inhaled. So if you're in the hospital and you see our staff walking around, the vast majority are not wearing N95s. They're wearing simple surgical masks. So N95s are not required. The other thing is I would absolutely recommend everyone wearing a mask of some sort, even a cloth mask. Really, you wear a mask to protect others, and you're wearing a mask to help prevent the spread of this disease, which you may have. And so I would recommend everyone, again, those 3 things: wear a mask, wash your hands, and keep your distance, as much as possible to help us prevent the spread. So yes, I would highly recommend wearing a face mask at the grocery store. I'll be the first to say, I know it can be uncomfortable when you're the only one wearing one. I will tell you guys, different settings have different feelings. Grocery stores, around here, it can be 50-50. I went and got my car serviced the other day. I was the only one wearing a mask. I got a lot of funny looks, but it's the right thing to do. And again, you're helping keep others safe, and you're helping hopefully help prevent the spread of this.
Great. One more question here. Now, what about endocrinology? Oh my goodness gracious. Now, this is the hard part about being on that board, is understanding all those big words.
Well, endocrinologists, so it's a great question, and they are in high demand across the country as it relates to endocrinologists provide a lot of care to diabetes. It's what they're largely known for. They do a lot of other things, but with the increase in diabetes across the country, they have been very difficult to find. So we have been recruiting 4 endocrinologists now for probably about 2 years. They are very difficult to find, and we have not been successful yet. We were successful in having an individual out of Charleston come down here more often. Now he's coming down here a couple of times a month, but it's not someone that's based here, not someone that's here every day. So that is definitely a need, and it's something we're working on recruiting, but we don't have a full-time option here today.
Okay, great. Okay, I think that is it for questions. I just want to share with you a couple little bits myself. One thing I want to share with you is when the hospital invests in all of these different, equipment. I mean, they're millions of dollars. You saw that, but not only that, but they really kind of reach out to the community. When we got the spine robotics, that was a fun project that the hospital did with the school children. They had them help to name the machine. It ended up being called Baxter, I believe. Is that right, Jeremy?
It fixes backs. So when you're a fifth grader, Baxter makes sense.
Right, exactly. So there's a lot of community outreach in what the hospital does here as well, whether it's, working this week with the RBC Heritage and certainly working with all of our vacationers that come in. Amazing the number of people that come through our hospital and our emergency room in a month. Those numbers are, took me by surprise how many people need those services. So this was a great resource and a great information, Jeremy, for our realtors to know about in our community that they can share. They're a great voice. They understand this past with COVID, although they've been an essential service. It has not been business as usual, and they're certainly working to do their part. They're social distancing by driving in 2 cars. We're not with their clients. They've got sanitation stations at their listings. I got realtors with lots of Lysol wipes. So we're trying to keep our part in helping to not spread this COVID past where we need to, and certainly recognizing our seniors. They're vulnerable. Our African-American community has some more vulnerability in regards to COVID. So all good things that we need to share that information and help to keep our community safe. So Jeremy, I have one last thing. Can you send me a copy of this presentation that I can share with our members? Okay.
I sure will. That would be great. And Jean, thank you again for having me, and thank you to all of you. I will tell you that, the past few months there's been a lot of, there's still fear in the community, and there've been good days and bad days, but hearing some of the recent sales numbers over the last month, I mean, that's really exciting. It's great for our community. And it's really great to see. So thank you guys for all you're doing and promoting our community. I say it all the time, we live in a special place. We live in a very special place, and you guys are helping make it that way as you continually find new folks who want to move here and help add to our community. So thank you guys for all that you did.
Thank you. All right, Jeremy, thanks very much. You have a good day.
Great. Thanks a lot, guys. Appreciate it.
Bye, everybody.